One vaccine that the country is talking about and hoping for. One of the others is a name that we've all been hearing the past year or so, just under a year, that being Ivermectin. The South African Medical Association says the lifting of the prohibition on the use of Ivermectin to treat COVID-19 patients is a step in the right direction. But I'm sure, as you imagine, there's a lot more involved than just saying, okay, go out and buy Ivermectin. It doesn't work like that. SAMA National Chairperson Dr. Angelique Coetzee joining us here on ENCA to discuss these developments. Dr. Coetzee, it's always a pleasure speaking to you. I know there's an awful amount to get through. We can't get through everything regarding Ivermectin. So I would like to start with just this. How have we gone from a drug ordinarily used by veterinarians, was being called for on social media, everybody was shooting it down in the medical fraternity, to you and I now sitting here and saying this actually might work for us? Good morning.
Good morning, and a good morning to all your viewers out there on this early Saturday morning. Yes, you're absolutely right. I think what is important when a pandemic arises and there's not a lot of medication that you can use, people, especially in the medical field, starts to experiment and see, what can use. We have all seen some of the other drugs that has been said to be effective, and in the end it proved not to be effective. So Ivermectin is one of this. And what is important to understand about Ivermectin and the recent compassionate access granted by SAPRA is twofold. One, it was because of a lot of pressure from the public out there and some of the doctors. The second one is we need the data. So by allowing compassionate access, that is a vehicle where we can now get the doctors who would like to prescribe Ivermectin under a controlled environment with getting the right Ivermectin, not the one that is used for animals, but for human use. That will be coming into the country. Hopefully, the doctor who would think that his patient is seriously ill or severely ill and would like to prescribe Ivermectin, then can apply to SAPRA. And SAPRA promised that within 24 hours after you have applied, they will, looking at the reasons why, they will then grant you the ability to prescribe the correct Ivermectin, the human one, and get it for your patient. And I think it is important to understand that this is not to say, yes, now we're going to use Ivermectin. Ivermectin is going to work. That is not the purpose of this. The purpose is let us get information, which has been so needed. Dr.
Coetzee, so just so people understand, this is not a broad and wide rollout of Ivermectin. You need to go and see your doctor. The doctor will then apply and find out whether or not you can actually get this drug. Do you think in the last 2 minutes or so, Doctor, that I have with you, do you think we'll get to a point where Ivermectin will get rolled out around the country? We've seen Johnson & Johnson, I've just been reporting on that story, their vaccine. If we bring Ivermectin into this for humans, Ivermectin for humans, do you think this could be the year where we could roll this out broad scale?
Sure, this is a difficult question because, again, the data, the clinical data on Ivermectin is very flimsy at this stage. And we will need to wait for the University of the Free State, and as I understand, University of Stellenbosch. They are going to do trials in the very sick patients to see whether you can use this or not. So in that case, there's going to be trials. So what SAPRA is now asking on the GP level, where everyone is saying, you know what, we are using it or you don't use it or whatever the feeling is out there, you can now apply. But let us get then the studies in. And that's why you have to apply to get this through SAPRA. Also, please do not put pressure on your doctor. If your doctor don't think you need Ivermectin, don't go shopping. Don't go to his nearest rival and say, please, Dr. X didn't want to prescribe. Please, can you prescribe it to me? Because that doctor still needs to apply to SAPRA. Let us do this in a right way, in a controlled way. We're still not a banana republic. We are still a republic and a country where there's rules and regulations to be followed. We cannot simply discard this and say, let us use a drug. It's been proven to be safe. No, not in COVID-19. Let us get the data. Help us to get the data.
Yeah, absolutely. Let's not start panic buying as well and start making irrational decisions, especially during the middle of a pandemic. Dr. Coetzee, it's always a pleasure speaking to you. You've made a lot of sense and I think given people a lot of clarity this morning. So I do thank you, Dr. Angelique Coetzee, joining us from the South African Medical Association. Ivermectin for humans, not for vets, is going to be given a stamp of approval. The words used by the good doctor, controlled compassionate access program. Your doctor will have to apply to SAHPRA in order to put you on ivermectin. Do not go out and buy it on the black market. The professionals are saying they do not know whether it is effective and whether in fact it's dangerous. So it's not rolling out yet. Go speak to your doctor, according to Dr. Angelique Coetzee. Plenty coming up for you.